Hey everybody, Dr. Orlando here with Vive Health. Today we're going to be talking to you about back pain and a little bit more specific back pain though. So a lot of times I have people that start to have back pain and they say, hey man, I think it's starting to radiate toward my hips or my groin. And I've had patients that even lay down or they're sitting and they try to cross their leg and they're like, man, that really sparks up my back pain. But they're not bending forward, they're not bending backwards, they're not moving side to side, they're just moving from the hip. So a lot of things that are connecting around our hip and around our pelvis also kind of start from the back and can even radiate pain forward or backward. So I'm gonna go through a few exercises that we're gonna do for the muscles around our hips with our glutes, our hip flexors and things like that. So that way we can try to relieve some of those symptoms and get that back feeling a little bit better and kind of that radiating pain to go away. So one of the things we'll do is make sure that we have a band, just like I do, right around the legs. So I like to go just above the knees so that way it's not on my knee and it's not kind of going forward and backward. And one of the most common exercises that I normally have people do first is just laying on their back and they're starting with what we call as a supine clamshell. So we're just separating the legs and then bringing them back in. And they're just getting those hip abductors active and their glutes active and they're just pushing out against that band. And if you feel like, hey, I'm so strong, I'm gonna friggin' break this band, make sure you get a stronger band. And if you feel like it's too strong and you can't move it, all right, let's calm the ego down and get a lighter band. So we'll go in between where it's like, yeah, I can feel some stuff and I feel myself working. After we do those clamshells, somewhere between 10 to 15 strong repetitions, then I like for people to push those knees out, keep them out, and then they're gonna do a bridge, right? So they're squeezing their glutes, they're trying to shoot those things to the moon and holding up on a tabletop and coming on back down. Okay, so we're gonna do those, but we are gonna pause at the top for about 5 seconds. You might feel a little bit in the low back, but that's normal. So we can keep doing those. Again, maybe since we're doing a hold, we're doing 10 reps there, but you should be feeling some pressure back here. Then I like to go to the side and then we're gonna open the leg. We're trying to bring that knee up toward the ceiling. And again, if you can imagine a clam, like a clam opening the mouth and then closing the mouth, we'll probably feel that a little bit on the outside. Again, you might start to feel a little bit of pressure in the low back, but as the hips get moving more and more and more, you'll start to feel some relief in that these movements feel more pain-free. So again, I normally do holds in this position. The only one that I don't do holds in is the supine clam. I just go back and forth. This is a sideline. So we'll do holds in that position about 5 seconds going up and down, and then you'll also do the opposite side. After we're done with that, normally what I like to do is I like for people to try to open the hip just a little bit. So now we got a little bit more movement and we're stabilizing on one leg. So we call these fire hydrants. If you're pretty quick, you would know why they're kind of called fire hydrants. If you need me to explain, if I were a dog and this were a fire hydrant and I kind of hit that thing, you know what I'm saying. So we're going back and forth, side to side, and then no pause here, just repetitions, peeing on the fire hydrant, just in case you didn't get it the first time. Going back and forth. So we'll do 5, 10, 15 reps, whatever you feel like that band will allow you to do without taking one off, putting one on, taking one off, putting one on. Again, I normally, for me, I've done these a while, so I like a medium to heavy strength. You might start with a light strength and that's perfectly okay. The last thing that I like people to do is we'll go to a standing position and we'll practice marches. The really nice thing about these bands is we can do them from above the knees or we can do them on the feet if we want a little bit different resistance. So I have people just shift to one side and lift the leg. So I'm gonna shift to one leg, I'm gonna be weight bearing on one leg, and I'm gonna practice a march. If you have bad balance, make sure that you're grabbing a hold of something, right? These are exercises that I want people to feel safe and comfortable with. I don't want them just falling around and stumbling. That's not the intention. But if you want to work on your balance and you feel like you're in a good, safe environment, then go for it. But again, about 10 reps and then you'll do the opposite side as well. If you want a little bit more resistance, you would put that band on the feet and you would kind of step on top of it. So again, they move. So right about there. And then again, now this is gonna be a little bit tougher. So for those of you that are like, I want a little bit more of a challenge, we can do it this way. You can kind of see me, I'm wobbling a little bit. But if you're pretty good at these, then awesome. As always, before you start to do these exercises, make sure that you check with a medical professional, whether it's your doctor, your local PT, whoever it is, because these are things that are pretty much anybody can do, all the way from my 90-year-olds to my 6-year-olds, you know, but if you have something going on, whether it's some type of injury, we want to make sure that you feel safe and that you feel comfortable doing it all and that you're appropriate to the exercises. That's all from us, guys. Thank you.